Guys, as promised, I'm going to give you a step-by-step or day-by-day of my oral surgery elective. So today was the start of my oral surgery elective. It's done at the KPH hospital. I told you that I would try to keep you abreast of what's going on. So today at 9 o'clock, I started my rotation. Today we had a clinic. But before the clinic, what they would do is they usually have a meeting where they would discuss the upcoming cases, describe what, the nature of the injuries that would happen. Most times we see trauma. We have trauma, but then in other cases we have lesions, cancerous, benign, or cystic lesions. So that took up maybe like half an hour this morning. Then we started to see patients. So once we started to see patients, it would be like there's like maybe 1, 2, 3, 4, 5, 4 rooms. Yeah, 4 rooms along one corridor, 4 operatories. And they have 4 dental chairs in each of these. One of them has a panoramic. And essentially what we did was shuttle the patients into these rooms and then examine, and whatever procedure needed to be done was done. So today I saw 2 patients with wiring of the jaw. One of them had the procedure done. The wiring was done today for a parasymphysis fracture, and the other person had their wiring done 6 weeks ago. So today they had the wiring cut, and the arch wires were left in situ because after the 6-week mark, the fracture is still not necessarily healed 100%. So they leave the arch bars in. And then after 2 weeks, they remove everything completely. So that was really cool to watch. Pretty much most of these injuries, the cause was motor vehicle accidents. Like 9 of 10 of them was motorbike accidents. Persons fall off their bike, knocked off their bike. So that is pretty disturbing if you think about it, because it means like most of these injuries are preventable by just simply wearing a helmet. Most of these persons don't wear helmets. So they come in, they have orbital fractures, zygomatic fractures, parasymphysis fractures. I saw one gentleman with a frontal bone fracture. Yeah. The other patients that came in, which was the majority of the cases, was like extractions. Third molar extractions, number 1, number 32. Yeah, those were the ones that were the real killers today. In one instance, the extraction itself was so difficult that they had to then get the drill to section the tooth into 2. One of the procedures that I must say was really interesting was a biopsy that was done by one of the senior residents. So what he did was basically make a flap. It was a mandibular lesion. The patient reports that they saw that their mandibular incisors started to get shaky and they started to shift position. So he was like, yo, what's going on here? So that's when he noticed that this lesion or so was extending buccally as well as lingually. So he came in to have it dealt with, as it were. So we didn't do the procedure, but the senior resident did the procedure and sent off the sample to be basically analyzed by the pathologist. So hopefully we can get some follow-up. Even though my rotation is only 2 weeks, I'm hoping to get some follow-up after that to just find out what's going on with that patient. So I'm hoping by the end of this rotation I would have at least done about 6 extractions or assisted in some. I'm hoping that my medical degree gives me a little bit of a leeway to do a little bit more than the average student, but I'm learning that they really do have a very solid line drawn between medicine and dentistry. So if I apply for a dental job, even if it's surgical, I probably wouldn't get it, even though I probably would get an ENT job, which is kind of confusing to me. I've said this before. So yeah, that's it so far. So I'm just making sure that I haven't missed anything. I saw 2 jaw wirings, about 4 extractions. We saw preoperative care of or preoperative booking of patients where they did consent CBC. So in some instances, some patients need chest X-ray depending if they're a smoker above 45, or had pre-morbid conditions like asthma, COPD. Some patients needed to have blood reserved for them. And some patients were actually admitted 2 days in advance because operating theaters on Wednesday, and they were being admitted today. So I learned about the actual clinic itself receives referrals from across Jamaica. We're talking about a population over 3 or 4 million people coming to see essentially a team of 5, 6 people. That's whoa. Oh, I forgot the best part. I saw a submandibular abscess. Yes, that was drained via. So the surgeon that did the incision and drainage thought that by removing tooth number 32, which was the source of the infection, that the infection would drain through the opening, but somehow that didn't happen. So he had to then make an incision on the buccal aspect of the cheek, and sorry, on the buccal along the cheek itself on the inside, and drain. So it drained about 15 to 20 mils of pus, like frank white pus. Learned something also where the pain from the abscess itself actually prevented the patient from opening his mouth. So yeah, I saw a pretty creepy case yesterday too, which I must say involved maggots, and yeah, that literally haunted me last night into this morning. As a surgeon, that's something that you have to get accustomed to seeing. I don't like seeing it, and no matter how many times I've seen it, I don't want to see it. It wasn't pleasant, and these are some big maggots, like half an inch. I'm not even exaggerating. And I kept talking about it today to try to get it out of my system, but it just kept haunting me and haunting me and I just keep seeing maggots, So, and I wasn't even in oral and maxillofacial surgery. So yeah, guys, if you want to do surgery, just know that there's a very big chance that at least one time in your life you're going to see maggots on a human being. That cannot be pleasant. It's not pleasant to see. So keep subscribing. Keep liking my page and just asking your questions. Ask your questions, and I just love to answer them. And thanks for subscribing.